Welcome to another edition of Cannabis Friends and 420 Buds. I am Elmer Renton.
I'm Megan Hall.
And we are the hosts of Cannabis Friends and 420 Buds. So I was doing some research for the show the other day, and I came across the second annual Medical Cannabis Conference put on by the Society of Cannabis Clinicians, and it looks super awesome.
So once Al discovered this, I started reaching out to the different doctors I felt would be relevant to the community. And I am very excited to introduce our first interview. Her name is Dr. Tanya Scott Cannady. And Dr. Kennedy, she is a doctor of nursing practice, a registered nurse, and an executive board of directors for the American Cannabis Nurses Association, just to name a few.
Yeah, so Dr. Kennedy is doing some amazing things to normalize cannabis in medicine, and I'm really looking forward to this interview.
Me too.
Welcome to the show, Dr. Kennedy. How are you doing today?
I'm doing wonderful. Thank you for having me.
Awesome.
Dr. Kennedy, thank you for being here. We know that you're busy. I wanted to kick off the first round of questions. What is your background and what is your mission?
Let's see. Well, I am a registered nurse of 31 years by profession and currently practice nursing as a healthcare clinical operations and patient care services leader in Oakland, California for a very large integrated health system. My professional mission is to advance the knowledge of all clinicians through the continued development of the connected health economy and now the connected cannabis health economy to ensure access, quality, and safe care for cannabis patients.
That's awesome. That sounds really great. How did you become aware of like the health benefits of cannabis and get involved with cannabis, with nursing and clinicians?
I have always understood cannabis as having properties that were efficacious in some way. It has always been around me, whether it was a family member, a friend, or even a teacher or professor. I became really fully aware of the health benefits of cannabis when I moved to California. And cannabis was clearly the preferred choice for members inside of the cowboy community and network that I live within. My husband utilizes cannabis and has for migraines post-military service and for anxiety and stress and things like that. So when you are living with someone and when you're around someone who is a consumer, then as a healthcare clinician, you tend to start looking at it a little bit differently. So being around adults of all ages and after asking quite a few questions about it, I realized that people were using it and they were treating all sorts of ailments from stress and anxiety to pain caused by conditions like arthritis, multiple sclerosis, degenerative joint disease, inflammation, insomnia, just so many other health concerns. And that's when I really, really got hip to, there's something more to this, and I probably, as a clinician, need to dig a little deeper into it.
That's awesome. So you have like a different kind of perspective than most clinicians, because you have like the experience of seeing it firsthand in front of you and being able to witness it. So that's very special. The view that you have, the lens that you're looking through. That's super awesome.
Love it. Doctor, you're at the forefront of integrating cannabis therapeutics into patient care. What drives your mission on this?
Clinicians by training are expected to be knowledgeable, and they're expected to be aware of the pathophysiology of all of the systems in the human body, such as, the cardiovascular system, the musculoskeletal system, the endocrinology system, neurology, you name it. So at no point in our education, which for many of us practicing today started over 20 years ago, were there chapters or clinical lectures on the endocannabinoid system, or ECS, and its impact on the body and the balance that it provides, or the homeostasis that it provides. So, when we start thinking about it to ensure optimal levels of care, quality, and safety for everyone, it's imperative that professional clinicians from the bedside to the boardroom understand the connected cannabis health system within the body and on the outside, and develop subject matter experts in cannabis to really assist in the development of proper care plans, whether you're inside the hospital or whether you're outside of the hospital in an acute care setting, or even in a skilled nursing facility, or just standing at the drugstore. At the end of the day, it is a clinician's ethical responsibility to have knowledge of the endocannabinoid system and be able to guide patients or consumers accordingly.
That's awesome. That's awesome. I really do believe that too, because I talk to doctors and different kinds of clinicians and even other kinds of practitioners, and I still to this day will occasionally hear people like an MD, like what's the endocannabinoid system, and so like the education, and I love how you say like that. There's like almost like a responsibility for them to be able to educate their patients and clients and things like that. That's beautiful. And we want to get into that a little bit more and the endocannabinoid system. But before we get into that, are there any stories that like patient stories that inspire you, that drive you?
For me, every story is really like a success story. When I find myself having an open conversation with someone who may have never considered cannabis as an option previously, mostly because of their bias and stigma associated against the plant that's been in existence for many, many years. When I see a patient who had no appetite and now they're eating, when I see a patient that was maybe slow to get up due to pain, pop right up after a bit of CBD cream on their knee or on an elbow, those are successes for me. So, one might be small, but when we start talking about people's quality of life, that's what I'm here for. That's a success.
Love that. Quality
That's
of
awesome.
life.
That's beautiful.
Yes. Doctor, you're an executive board member and treasurer of the American Cannabis Nurses Association. Can you give us more insight into this organization? It's still very new to people like us. So let us know more about it.
Well, let me first start by saying everyone knows that the profession of nursing is the most professionally trusted profession that's out there. It's been that way now for, I think this is our 22nd or 23rd year that we get that distinction. So the American Cannabis Nurses Association, or ACNA as the acronym is a professional organization that's of nurses dedicated to educating nurses and advancing the role of nursing within this rapidly growing cannabis industry. The organization serves as what I would call a hub for nurses who are interested in cannabis as a therapeutic treatment option for patients. The organization really advocates for the recognition of cannabis nursing as a specialty, which officially occurred with the American Nurses Association making that recognition in 2023. This was really significant for us. It was a significant milestone. ACNA helped drive those efforts through our credentialing committee at that time led by Dr. Deanna Summers. And that formal acknowledgement by the American Nurses Association really legitimized cannabis nursing as a specialty field, as a specialized field, and really set that tone for what we now have published, which is our scope and standards of cannabis nursing practice, and soon our national certification in cannabis nursing.
That's awesome. You're gonna have a national certification. That really, that for sure. That's awesome. That's beautiful. So will there be like a repository where people could access like cannabis friendly nurses and things like that?
Yeah. The goal is to be able to, well, of course, the ultimate goal is that every clinician is cannabis friendly, right? So ultimately, while I love locators and I love how do you find, at the end of the day, any person who practices should be cannabis friendly.
Yeah, for sure.
I done on that. That's boss level things.
Yeah. So
I mean, I'm heart friendly, right?
Yeah.
I know about the heart. I know about, I know about bones. I'm bone friendly.
Right.
So
that's awesome. That's awesome.
It makes sense when you say it out loud.
Yeah.
Yeah.
So I know so you're working with nurses and doctors, clinicians and stuff. So do you still get to work on the front lines with patients?
Absolutely. I work with people in general, and what I have to remind people is that even I'm a patient at the end of the day, technically, right? All of the nurses that I work with, all of the physicians, we're all somebody's patient at some point. But what's really great is that our nurses, we have nurses who are at the bedside who are just as much cannabis nurses and specialty cannabis nurses as someone like myself who may sit on the board or be an executive, right? Their their perspective is coming from that of a clinical expert. So what they're doing is, when we think about, excuse me, one second. Sorry about that. When we think about a cardiovascular nurse, for instance, at the bedside, what that nurse has done, or that frontline nurse has done, is that they've taken their specialty, clinical specialty of cardiovascular nursing, and now they have looked at and researched cannabis and how cannabis impacts the cardiovascular patient. And so it's now, they're still cardiovascular nurses, they're still on the front line at the bedside, but they're also considered specialty cannabis nurses because they understand the impact of cannabis on that cardiovascular patient that has chosen cannabis as a therapeutic option versus, say, a pharmaceutical of some sort.
Gotcha.
That's
Hey, that's amazing. I want to bring it back to the endocannabinoid system. All right. Why isn't it taught in medical school? And like, where's the stigma at? Where are we at with that? Why has that not been a thing?
Well, I wish I really did know why we have not gotten to that place yet of really teaching it, right? Because the endocannabinoid system, or ECS for short, is really this complex system that plays such a crucial role in regulating a variety of physiological processes inside of the human body. So it's something people should really know about. We really want people to understand it, right? But despite the significance of the ECS, we have to keep in mind that the endocannabinoid system was really just discovered in the 1990s, while researchers were really focusing on the effects of THC inside of the cannabis sativa plant. And so little did we know that there was this whole system that was connected inside of our body that we needed to know more about, that had receptors and all of these things influencing our mood and memory and appetite and inflammation and immune response, all of these things. So when we start thinking about education, right, we've got to deal with the fact that there was a historical stigma surrounding cannabis for a very, very, very long time. And we know this history. We know the legal and the social stigmas associated with it here in the US. And we know that criminalization of cannabis in the 20th century by the scheduling and making it a Schedule 1 created a limitation to how we research and a reluctance to really incorporate it into our mainstream education. So it just became this thing that was just bad. You don't talk about it, you don't mention it, you don't discuss it, and if you see someone on the street with it, you profile them and arrest them.
Yeah.
So, you know, that whole piece has kept so many people away from education and away from the ability today, now that time is shifting and we're starting to evolve a bit more and realize that this isn't a drug, it's a plant, right? So now that we're decriminalizing this plant, we're creating more awareness around it. We know that the National Council of State Boards of Nursing in July of 2018 made it an expectation that in the schools of nursing, amongst nursing students, there were 6 essential principles that they expected new nurses to be able to speak to and to be able to be tested on at some point when it came to their nursing boards. And they expected nurses to have a working knowledge of what their current state of legalization of medical and recreational cannabis use was. They expected nurses in that issuance in 2018 to have a working knowledge of the jurisdiction whereby which medical cannabis had become legal. They expected nurses to have an understanding of the endocannabinoid system, cannabinoid receptors, cannabinoids, and the interactions between them. And they also expected nurses to understand cannabis pharmacology and the research associated with it. They needed to be able to identify safety considerations, and then really understand how to approach patients without judgment. So it's there, you know, it's there for nurses. We know that. The medical association is moving just a tad bit slower, but nurses definitely have that expectation sitting out there. Our schools have been a little slower on the uptick, but then again, you also have to have individuals who can teach at the professional academic level and they have the subject matter expertise themselves.
Yeah, for sure, for sure. That's got to be one of the obstacles is to find those people, right?
Yeah.
You know, that actually have that knowledge. It's that is one of the problems, you know. And I fully understand the benefits myself because I don't know if you know, but I went blind from glaucoma and got my vision back with cannabis oils, you know. And
wow, there we go.
If I stop taking my oils, I go blind in less than a week, and and I have over 10 years of sustained success. So yeah, I fully believe in it. And then once I found out about the endocannabinoid system, it was like, you know, what the hell's going on? You know, but yeah, like there is a stigma, and it's almost like we're having to like relearn, you know, what was taken away,
yes.
you know, way back when.
Exactly.
Yeah.
Exactly.
So, are there any like obstacles that you come across when you're trying to educate like doctors and nurses and clinicians that maybe are hesitant? They're not like outwardly accepting of it. You know, are there any obstacles that you come across?
Of course. The biggest obstacle is the word cannabis.
Copy that.
So that's the first thing. So
Yeah, it's almost like it triggers something, right?
Yeah, I go ahead and I get it out there. I say it immediately. I'm a cannabis nurse. You can see the reaction. You can see them holding it together. How do you react? Because you also have to address me as doctor.
Yeah.
That makes it even more challenging, right?
Yeah, that's awesome.
So, and it's a bona fide degree, you know.
Word, yeah.
Actually,
Yeah.
did all those things. So, you know, so it really makes people have to stop and evaluate their own bias personally first.
Right.
So if you're looking at me and you already have a picture of what cannabis looks like, because of the era I grew up in, cannabis looked like Spicoli from
Fast Times.
there you go, Fast Times at Ridgemont High. That's cannabis, right? Or Cheech and Chong, you know, whatever you grew up, that's what it looks like. I think what I'm trying to make sure people understand and clinicians understand really is that we have a whole generation of people who have grown up with it being legal now. And so it doesn't look like Spicoli anymore. It doesn't look like Cheech and Chong at the back of a van, smoke, all that. It doesn't look like what we were being told were potheads, right? We did not grow up with it being something that was medicinal in respect. We grew up with it looking a different way. So in order to invigorate nurses, invigorate clinicians, and help them understand that we've got to evolve, you know, it's time to evolve. We have to make it more interesting for them. So the first thing, you know, you throw a little shock in there. So I say the word cannabis. Then once everybody gets themselves together and you know, we may even have to say it all together. Okay, everybody say it together. We're going to get it out, right? Because we need people, clinicians, to be able to talk just amongst ourselves.
Yeah.
Clinicians can't even comfortably talk amongst ourselves, and you want us to talk to people, patients, consumers. That makes it a little bit more challenging. So we have to create environments where our clinicians feel comfortable. So in order to do that, we have to create peer-led education. So workshops, conferences. We have to not just stick inside the cannabis industry space for conferences, but we need to go out there where most people know us, who know my credentials, who know what I already know, and I'm trusted for that knowledge. Now I'm giving you something new. Now I'm sharing something else with you, and I believe in it.
Right.
I trust it, right? So I've got to be willing to put my credentials out there and to support it. I have to be able to encourage individuals to debunk the myths. So if they've got patients and stories that they can tell, you'd be amazed. Every time I will tell a story or give a presentation, someone gives me their story. Everybody's got them. It's either a family member, it's either a friend. Yeah. It is a personal thing, and it's far more personal than what most people realize. Far more.
That's awesome.
Beautiful, Ansel. It just leads me to my next question to you. How do we get doctors and nurses excited about cannabis, and how do we break the stigma altogether?
Well, you know, we really do need to start with the education. You know, it starts with that, because when you have individuals who don't know the difference between the non-psychoactive options versus the psychoactive options, you know, it makes it a little challenging for them to get excited because they only think about one thing. They can only see one thing. So we want to make sure that that education is there, that we're sharing that. We want to engage them into the professional organizations, and we want to make sure that we're interacting with other disciplines. So that means that for cannabis nurses, we cannot just go to cannabis conferences. We have to go to cannabis conferences where there's going to be pharmacists, where there's going to be physicians, where there's going to be a multitude of disciplines that we can come together with them and share knowledge and help them understand their role better and how our role as cannabis nurses fits into the overall patient care focus. So, it's coming, a few scholarships, maybe some grants to go back to school would be helpful. But I think overall, I think it's coming. It's just when you don't know how to do something, it makes it a little hard to start.
Yeah, for sure. And I could see like the younger up and coming doctors, being really receptive to it, and that's going to be an exciting experience. But just for the doctors and nurses that may be listening to this, what benefits what could they expect if they were to incorporate it into their practice?
Well, first of all, your client base is going to increase right off the bat, because many people who are consumers today don't even go to the doctor or a practitioner for fear. They have a fear, right? That they're going to get kicked off of their insurance. They have a fear that the doctor or the practitioner is going to kick them out of the practice, whatever the case may be. So at the end of the day, you get to open up to a whole new group of folks coming in, which is wonderful, which is awesome. But then you also are going to have to be able to share with your patients and consumers. You get to share this comprehensive treatment option, right? Because not everyone chooses to medicate with pharmaceuticals, and people should not feel like they're mandated to do so, right? So where you have patients who don't want that pharmaceutical medication, this is another opportunity for you. Right. Symptom management. We all know, widely known, that cannabis can manage symptoms like chronic pain, anxiety, nausea, insomnia. We already know that. We know that it's good for PTSD. We know it's good for MS and cancer-like symptoms. So it's just sitting there as an option. Right. But stigma, bias, that's what's keeping you from supporting your patient a little bit better. Right. It also gives the benefit of creating a more holistic and natural practice, which I'm amazed to see so many practitioners who are holistic, but for some reason this plant hasn't made it there yet.
Yeah.
But they have herbs for everything else.
Right.
Yeah. I was talking to Megan about that the other day. I feel like some of those people are almost like shills because they have all this other stuff, but they can't see the benefit of cannabis and CBD. It's like that's ridiculous.
Or they can, but they ain't saying nothing about it. They're like,
there you go. So you know what? We have to establish a more non-biased approach to practice, right? And I believe by clinicians, if nothing else, if clinicians educate themselves to be able to at least have a conversation about it, whether or not you like it for yourself or for your family or whatever the case may be, that's not where I'm going with it. I'm going with, I should be able to talk to you as my clinical support person. I should be able to talk to you about anything, really. And so if we've got this non-biased approach, then I think that we're going to be able to impact health equity at a greater level, right? Because there is nothing worse than when you disclose cannabis use to a clinician and the reaction is dismissive, the tone changes to condescension, right? The eyes roll. And while you don't hear that direct wording, I don't want to talk about it, for me, I know the translation from many clinicians when they kind of circle around on that little stool, it's more of, I know nothing about cannabis and therefore I can't talk to you. So don't ask me questions.
Yeah, for sure. Yeah, and it's a real deal too. I'll just put a quick story in here to let the audience know, because some people might not be aware of how much of a stigma there is and up against it. But like my brother, he was in Vietnam, so he's part of the VA, and he had like super hardcore chronic pain from working in the oil industry and forever. And I had given him some this thing I call rolling relief, and he put it on his neck, and it has like this RSO, Rick Simpson Oil, inside of it, among other things. And he used it because he had to drive like 2 hours to the VA in Nevada, and he went there, and they tested him, and he tested positive for cannabis, and they threatened to take away his VA privileges, and we're going to take him away, blah blah, and he had to like fight to convince him to keep his VA privileges so he could, have his medical and all that kind of stuff. So it is a real stigma around it right now. Still to this day, it's amazing.
Absolutely. It's really horrible. And it's a huge reason why you see so many individuals not willing to go to seek help. And that's truly a problem. And it really is unfair to the patient. It establishes when our clinicians are not open, just even to having that conversation and talking about it, it establishes that foundation immediately of inequity. And it must, and to me, that is something that must be owned by the clinician to fix, not the patient, because the patient ends up just wandering around until they find someone that they might be able to talk to about it. Meanwhile, just simply suffering in silence. And that's not ethically who we are supposed to be, right? I don't particularly care for methamphetamines and cocaine and crack, but I certainly will talk to the patient about them.
Right.
So with us just talking about a plant, I'm just confused as to why it still continues to be such an obstacle when we have 38 states that have legalized it at this point.
Correct. That's great. Well, and with that being said, let's dive into, how do you vet your cannabis? Like, for doctors and clinicians that are sourcing quality cannabis, how do you even go about that protocol?
So let me say it this way. The cannabis industry is still evolving, right? And so are the regulations, which truly vary widely. And in the United States, cannabis is regulated at the state level. And while CBD, we know, is derived from hemp, it's federally legal. So each state has its own licensing and regulatory framework for medical cannabis and dispensing. And so typically we leave that, that's what the dispensaries are for. So as a clinician, I'm not necessarily vetting it per se. We know that those dispensaries have to abide by the local quality controls and the testing requirements. So there is no, what I would call, standardized vetting process or a universal standard that's kind of sitting out there for clinicians to follow. However, we do our own individual research. And I encourage clinicians to do their own individual research as common practice. So for instance, reviewing product lab reports, or what we call certificate of analysis, to confirm that there's consistency in products and purity in their batches. There's no metals, so look at those COAs, and those COAs are supposed to be available to you to look at. And spend some time investigating the manufacturers' reputations and look for ethical production standards. Talk to people. That's why I like going to certain conferences, because the technology people who are building the devices that cannabis consumers are using, they're at those conferences and they're talking about their lab testing quality. They're talking about all these things. So spend time at those types of conferences to learn more. I encourage clinicians to thoroughly review the cultivators that are out there? What are the chemovars that they're growing? And what are the consumers saying about their chemovars or their strains that they're creating? Partner with dispensaries. That's another one. You can partner with a dispensary to provide not only support with their consumers, but really to support the consumer making an informed decision when they come into a dispensary. They don't know about COAs. They don't know necessarily about dosaging and routes and things like that. And so there's an opportunity to learn more about the strains or chemovars, because your bud tenders, they have a great knowledge, right? And then you've got a clinical knowledge. So again, there's a lot of opportunity there for clinicians to vet, but not necessarily. But there is no formal process.
Copy that. Beautiful.
Right on, right on. So, with as far as patients are concerned, because like some are like apprehensive and things like that. So how would what do you feel are the best ways for them to like locate a cannabis-friendly doctor in today's world?
Well, I always encourage everybody, start with your own doctor. Just ask them. Just ask them. You might be surprised. You never know. I did it with my own doctor. How do you feel about cannabis? And so it was a great conversation and all of that. And it definitely got her thinking differently, right? Yeah. So definitely I encourage you to start with your own. But if you can't start with your own, or you don't want to start with your own, then, websites like Leafly's doctor locator. I think Leafly's has a doctor locator on it, or Weed Maps have options for locating clinicians in the space. Those are definitely ways that are kind of sitting out there, but it's becoming more and more knowledgeable, even at the state level, especially where medicinal cannabis use is legal, for there to be resourcing on state websites for accessing clinicians. So definitely I encourage the consumer to go to the website for their state, look to see if there are registered clinicians already that are within that space, that the state is actually encouraging people to use. And if it's not there, then definitely, look to the internet for like Leafly and Weed Maps, those types of organizations that have been around for a while.
That's awesome. I like how you started that out too, like when asking the question, like asking your doctor, how do you feel about cannabis? Because like most of the people will ask actually they'll start it out by telling their doctor, like, hey, I'm going to take some cannabis, or I'm thinking about taking cannabis, but they don't actually just try to do it like in a conversational thing, and approaching it that way, I think would be a lot more. The doctor and it's the conversation will go better that way. So I love that.
Most people feel rushed. They go to the doctor and, they feel like they only have 15 minutes or they only have 20 minutes. And so they're trying to cram everything in and get it all in. Well, this is the thing. Make an appointment to go talk about that.
Right.
You have a pain or you have something going on that's there, but then have a conversation about that while you're there. Write your questions down about it and have that conversation with them. I don't believe that doctors or practitioners should be dismissive about it. And if they are, then perhaps you need a different physician or practitioner.
There you go. You're awesome, by the way. Sorry, just side note. So I had a chance to really review your website, which is beautiful. We'll get into how people can find you in a little bit. What is connected health theory and how did it get started? And I know that your team has been working on that. Can you give us more info on that?
Yeah, well, the connected health theory started for me back in 2006. And it really was about looking at how do communities come together, whether they're related or not related, and connect through electronic mediums, whether it's social media platforms, telemedicine, whatever the case may be, to really specifically discuss health and wellness and utilize a coordination of care in order to be able to remain connected. So for instance, in healthcare is the one place where we disconnect from, if you think about it. Everything else that we do in life is connected. We might have a watch on that connects us to the phone so people can call us. If we decide to walk down the street, that walk and those steps get counted. As soon as we walk into a hospital, that stops. And stuff happens. And then we go and we leave the hospital and we disconnect again. So it's one of those situations where the connected health economy speaks to creating solutions that allow us to remain connected to our care all the time. So if I have a question, if I have an issue, if I have a concern, I should be able to reach out and talk to people, not just Monday through Friday, not just between the hours of 8 a.m. and 5 p.m. But I should always be able to do that.
Right.
How do we make that happen? Connected cannabis health economy is the same concept, but for those individuals who have chosen to self-medicate with cannabis. So how do I stay connected to my care, my cannabis care, and to clinicians who can connect with me and help me understand this may be a strain or a chemovar that I should be using. This is a terpene that I should try, those types of things.
That's awesome. That's awesome. And so as far as that's concerned, how do you feel like where's the future of cannabis currently with the medical field? Do you feel like it's going in the positive direction? It seems like you do, but do you feel like it's going in a positive direction?
I feel like it's going in the direction that it can only go in, which is towards legalization across all of our country, and potentially rescheduling and descheduling. So the one challenge that we've always had, because cannabis is a Schedule I, we are not able to do the type of research that we need to be able to do with human subjects in order to be able to share and show the evidence. We can, of course, do retrospective clinical reviews and things of that nature, but we really want to be able to do real-time study with consumers who are consuming right now. Right now, if patients have disclosed, we could probably do a retroactive pull inside of patient records and see potential causation or correlation. But really, we need to be able to do some real bona fide evidence-based research, and rescheduling from Schedule I to at least Schedule maybe 3 will be helpful for us to be able to at least move research forward. So those conversations have already started. We know that public comment has already happened. And so I feel good that we're moving towards that rescheduling. Hopefully from there, we'll get more, that will give us more time to put policies in place, get acute care, healthcare in line from a policy perspective, get everything together so that when descheduling happens for this plant, people aren't completely caught off guard, but that we have policies in place for how do we manage when individuals bring product to the hospitals or into the skilled nursing facilities. All of those policy has to follow. We have to have those things in place. So I believe that this is the time for healthcare to stop being so gun shy let go of bias and stigma and recognize that evolution is happening and that you don't see consumers drinking alcohol at the same level, but you do see consumers consuming cannabis. Yeah. And so it's time for us to recognize that there is a shift in the force. Yeah. And we do need to educate ourselves so that we can better create the types of policies that do not make our patients feel like criminals when they come into the emergency rooms or when they come into our clinics.
That's awesome. And it's cool that you like your ultimate goal is to see it descheduled, not just rescheduled, right? So there, but there is a process rescheduling, the descheduling. That's awesome. One other question that I have related to that is, are there any since it is still the Schedule 1, are there any repercussions from the AMA or anything like that a doctor could be fearful of, as far as their practices involved if they promote cannabis?
You know what? I look at it from the perspective of I'm not promoting anything. What I'm doing is I'm an advocate of education. Mm-hmm. And I look at this from an ethical perspective, which is the way that I think that all clinicians should be looking at it from.
Definitely.
You have individuals who are consumers, and in the state that they live in, that you practice in, it's legal for them to consume. So as a healthcare clinician, for you to not be knowledgeable, there's something ethically, that's a moral and ethical issue. Right. We don't have that as an option, I don't think. Just like I don't have the option of not knowing about fentanyl. I don't have the option of not knowing about all of these other things that are out there, right? So I don't necessarily look at it from that perspective or encourage clinicians to look at it, because the board, every board from medical to nursing, they all encourage us to get education. Mm-hmm. They expect us to have continuing education hours every time we come to renew our license. So what I'm advocating for is for clinicians, hospitals, facilities, systems to encourage this education and provide avenues and subject matter experts for individuals who choose cannabis to be able to more properly manage care of those patients when they do so. That's all I'm doing. That's all.
That's it. Just that. Oh my God.
That's awesome.
I love your human-centered approach. Like, you're really heart-centered as you move forward with this, which is a beautiful thing. Like, I'm just so happy you're on the team, yo. Like, that's so good. Doctor, you're speaking at the 2nd Annual Cannabis Conference in Baltimore, Maryland on October 12th. Can you tell us more about that? And do you have goals for the conference?
Well, you know what? I'm excited to be able to represent ACNA at the 2nd Annual Cannabis Conference in Baltimore. And really, it's going to be an exciting day, right? Because you're going to have all of these experts. And I've looked at the lineup, and between the physicians and the nurses that are going to be there and the pharmacists, I mean, it's one of those conferences that you just really want to be at, because you've got all of these disciplines in one space, and we're all going to be having conversations, right? So I love that I'm going to be there for this conference. The goals for the conference, again, continue to be creating space for clinicians to be able to ask questions, to talk about the future and what it's continuing to evolve into by discipline and by state, and really looking at those states that are really progressive. We know Maryland is very progressive in terms of their cannabis and their regulatory requirements, and So I've been to Maryland once before to a conference with CANRA, and it was really a great place to have a conference because you could really tell that state officials, local and state officials, were really engaged. And so again, for this conference, I'm really looking at being able to network and connect to more individuals, other disciplines, not just nursing, but other disciplines who are indeed fighting the good fight, encouraging movement inside of our acute health facilities, and being able, again, just to make those connections and create new avenues for us to be able to invite consumers in and make them feel more welcome and comfortable.
That's awesome. That's beautiful, and it's inspiring to me to see you and other clinicians and doctors, etc., nurses, etc. Like so proactive for this, because I'm 58 years old, so I grew up in the the era of just like this is your brain on drugs, like all that kind of stuff,
Right.
and yeah, so it's just beautiful, because it's I've been involved with cannabis since 1987,
Mm-hmm.
and so I'm a true believer, and I fight the good fight every day, so but it's awesome, like I said, to see actual clinicians and doctors and nurses, etc., to on board, like fighting that good fight, for the plant and for people in general, and their health, and putting the people at the center of the stage instead of trying to have some little differences because you have a bias or this or that. So
Right.
so we basically applaud you for what you're doing.
Thank you
Very
so
much
much.
so.
I appreciate it. I enjoy it. I love doing it. After 31 years in the space, we'll go out with a bang. How about that?
Yeah, for sure. So for the people listening, especially other clinicians that may be listening, they say, hey, this woman's awesome. Like how can we find out more about you? Where can they find you?
Well, you can always visit me at Tanya Scott Cannady, CANNADY.com. Or you can just email me at dr.TanyaScottCannady.com.
Awesome. Yeah, and we'll be sure to put all the information in the show notes below. That's beautiful. But thank you very
Doctor,
much
it's an
for coming
honor.
on the show.
An honor. It's just what a breath of fresh air you are.
Thank you. It's been my pleasure. I've loved it. I can talk cannabis all day.
Thank you for your service, for real.
Thank you so much. Thank you so much.
Dr. Kennedy. Okay, so that concludes this episode of Cannabis Friends and 420 Buds. Be sure to leave any questions or comments below and subscribe to our channel if you enjoy this type of content. Reach out to support at myfitlife.net or schedule a complimentary call if you have questions about RSO or FECO, how to take it, or where to get it. This is Al Morenton.
I'm Megan Hall.
And we are the hosts of Cannabis Friends and 420 Buds. I hope you have a beautiful day. Peace.